welcome friends to our channel Nursing Informatics. Today we are going to discuss about the blood circulations through heart. Okay, so if you like my video, if you find any helpful with my video, please like, subscribe and do share. Okay, so let's start. Blood circulation through heart. Okay, so heart is an organ which is contained of 4 chambers, that is right atrium, right ventricle, left atrium and left ventricle. Most commonly in the GNM and BSc or post basic, the question may come how the blood will circulate through the heart. Okay, so here the heart is contained total 4 chambers: right atrium, right ventricle and left ventricle. And in the above there is 2 lungs, and this is superior vena cava, SVC. IVC means inferior vena cava. This is inferior vena cava. Okay. Next, this is tricuspid valve. This is pulmonary valve, and this one is mitral valve. Okay. So how the blood will circulate towards the heart or through the heart? Mainly the coronary arteries circulate the blood in the heart. So the blood enters in the heart through superior vena cava and inferior vena cava. The blood will enter through superior vena cava and inferior vena cava in the right atrium. First, blood will enter in the right atrium. Okay, and when right atrium contracted, this valve known as tricuspid valve opened. Okay, so when the right atrium contracted, the tricuspid valve opened and blood will come in the right ventricle. And after blood coming in the right ventricle, when the blood is full in the right ventricle, the pulmonary valve will open. This one is pulmonary valve. The pulmonary valve is open, and through the pulmonary artery from the right ventricle, blood enters in the lungs. So that first right atrium, from the right atrium blood come in the right ventricle, and from the right ventricle through the pulmonary artery the blood goes in the lungs for purification, because in the right atrium, in the right ventricle, blood was deoxygenated blood, and this deoxygenated blood through the pulmonary artery go to the lungs for purification. Okay, after purification in the lungs through the pulmonary vein, through the pulmonary veins, the blood will come from the lungs to the left atrium. This is oxygenated blood. Means oxygenated blood comes from the lungs through the pulmonary vein in the left atrium. And when the left atrium become contracted, the mitral valve opened. So due to open in the mitral valve, the blood comes from the left atrium to the left ventricle. And from the left ventricle through the arch of aorta, blood supply throughout the heart, whole body. Okay, so this is the simple diagram, and this is the flow chart. It will help to remember easily. See, blood will enter through the superior vena cava, inferior vena cava in the right atrium. Okay, from the right atrium, when heart is contracted, right atrium is contracted, through the tricuspid valve, blood come in the left atrium. Right ventricle. It is right ventricle. Okay. So after from the right ventricle, if right ventricle, when the right ventricle contracted, the pulmonary valve opened. This one is pulmonary valve open, and from the pulmonary artery, blood goes to the lungs for purification, and from the lungs through pulmonary vein, it comes in the left atrium. And from the left atrium, when left atrium contracted, the mitral valve open, and through the mitral valve, blood comes from the left atrium to left ventricle, and from the left ventricle through the arch of aorta is supplied throughout the body. So this is the simplification blood circulation through the heart. It is an easy process to remember. For the 5 marks it came, the blood circulation through the heart, and the 2 major MCQ. First one is pulmonary artery carries deoxygenated blood. Remember. Second one is pulmonary vein carries oxygenated blood, and heart contain total 4 chambers. This is enough for the blood circulation through the heart. If you like this video, please do like in my channel, do share, do subscribe my channel. Okay, and if any query is there, please comment in the comment box. And one thing is, hold the note I have given in the link. If you need, you can download. Thank you.